Hi.
All right.
We are now, this is another episode of the Hawkins STEM Chronicles. And we have a very special guest today. And this gentleman is not just a doctor, he is a scientist. And do I have permission to record this?
Yes.
Okay. We are here with Dr. Lorne Garrettson. And Dr. Lorne Garrettson, aside from being a scholar and gentleman, and he's very, very interested in history, he's into poison. So, please, Dr. Garrettson, let's talk about poison for a while.
All right.
Okay.
Well, I went to medical school in Johns Hopkins, and the poison that was important to us, to me and my training there, was lead poisoning. Baltimore in the 1950s was the only place in the United States that was looking for and finding and treating lead poisoning. Now, when I was a resident, we would get children coming in who had constipation. That was the mildest disease that they would have. And their levels of lead would be 80 to 100. And then we'd get kids coming in who were convulsing, and they had lead levels over 100. And we would put them on chelating agents, drugs that would bind lead and take it out into the urine. And what had happened was that there was a third-year medical student back in 1932 who had a patient on pediatrics that had been diagnosed with tuberculous meningitis, and she somehow did not agree with that diagnosis or thought there was something wrong with it. So she made a house visit, and she found that the family was burning lead-acid batteries in their wood-fire stove in their house. She came back and told her attending, and
the attending physician.
That she was working under. She was a third-year medical student. And so the two of them went to the city health department and asked if he wouldn't do a lead assay for them on this boy. And he said he didn't have the capability of doing it, but he knew how to get it done. So they brought him some blood, and the kid was very, very seriously lead poisoned. Well, that started Baltimore in looking at lead poisoning. Now, the old homes in Baltimore, many of them were being lived in by recent immigrants from the South. South Carolina and Georgia would give any African-American person a one-way bus trip north, and many of them stopped in Baltimore and were put up in these old houses, which were at one time nice houses, well made and well painted, but they were falling apart, and the paint was lead paint, and the kids were eating the lead paint. So that's why Johns Hopkins was treating a lot of lead-poisoned children. And as I mentioned, their levels were from 80 to 100 and 120.
Out of?
There was micrograms per deciliter.
Okay. And
we would treat them until their lead levels got down to 60. And I could remember one time when we were sitting around shooting the bull at night after we'd had a day's work, and some guy, one of my colleagues, said, "I wonder if lead hurts you if your level's under 60. Well, right after, that was in the 1950s. In the 1960s, a group of medical clinics throughout the United States decided to do that study. And so they got, and it was I think they had way more than 100 patients that they'd studied. And what they did was they got blood leads on them and did an IQ test on all of them, and then plotted blood lead against IQ. And it was a straight line. And it was, that was their highest patient was somewhere around 60, which you're not grossly symptomatic with a level of 60. Mean population level in the United States was 15. and it was a straight line from 60 down to below 15, so that it was showing that lead was causing intellectual deficit at levels even down at the population levels. And that's when this country got interested in doing something about lead poisoning. And in 1978, the legislation took lead out of paint, so you could no longer put lead paint in your house. And people started learning how to take lead paint off of the inside of a house, which is a big job. I know there's a man who did many training programs for contractors at Georgia Tech when I was living in Atlanta, and I always gave his medical lecture for him to the people he was training to do that. We also then took lead out of gasoline because of that study that showed this, and we have it. Now, mean population lead levels in the United States are 2. Remember, I used to treat my patients until they got down to 60 and sent them home, and we now know that 60 is, you're losing IQ points, even at much lower levels than that. So we've had a real change in how we approach lead poisoning. And now we've got it out of paint and so on, and now the government is trying to finish it all off by getting the last of lead pipes out of the ground that bring water into our homes. Now, they aren't leaching very much lead anymore because they're mostly calcified over, but they still leach in some lead. And so we know what. Now, lead is up to 60 or 70 or 80 is simply, causes intellectual deficit. Above that, you get really sick, and that's where we started. It's, that's how I really got interested in lead poisoning, is because I did my training at Johns Hopkins Hospital. When I got done with my residency training, I took a job at the CDC, and I was doing something in a lab, but while I was there, I had time to spend time at Emory University. CDC was on Emory University land, but their main hospital is downtown in Atlanta called Grady Hospital, and I would go down there once a week or so, and I would join with one of the first training programs in clinical pharmacology that was going on at Emory. And I became fascinated in clinical pharmacology, that is the study of drugs and drug use in humans. And I published, I got in and did a study on the elimination of drugs in children and so forth. And I took my first job going to a department where there was a man doing clinical pharmacology in pediatrics. And that was not a very exciting place for me. I spent 5 years there. But then I took another job at VCU, where I had a lab, and I was on the faculty of the pharmacy school as well as the pediatric department.
Now, sir, let me interrupt you for just a second. VCU is an acronym for?
Virginia Commonwealth University, the major medical, there are 2 major medical schools in Virginia, that and University of Virginia, and it's right downtown in Richmond, Virginia. My office and lab were 2 blocks from the state capitol. That's where it's located. And I had a lab there in which I was doing pharmacokinetic studies on anticonvulsants in children. And this was a time when the study of pharmacokinetics, how the body deals with a drug, the elimination and the distribution of drugs in the body. And there was a relatively new discipline in medicine. and I was doing some on anticonvulsants in children. And while I was there, and that's how I got into this study of drugs in children. But I was also, this was just a few years after we had our first poison centers in the United States. And the poison center in Virginia was sort of split between the two big universities, University of Virginia and VCU. And the man at the University of Virginia and I got together, and we sort of co-founded the poison center system in Virginia. And we had the two, depending on where you were in the state, your telephone call went to one of us or the other. And we had a call center where people could call if they had questions about their child being poisoned, and we could get answers and direct therapy and so forth. And that's really when I got really into the acute poisoning line of study and interest, and I was active in the poison center systems of the United States.
Now, Dr. Garrettson, so you go to medical school. What made you decide that you want to be a pediatrician?
I don't remember specifically, but I remember that as a third-year medical student, I simply became fascinated by some of the diseases that I was seeing in the pediatric hospital of the medical school. And so I decided that that was interesting. But I was worried about becoming a pediatrician because I'm the youngest in my family. I never babysat. I'd never been around children at all, and I didn't know whether I could get along with very young children. So
Despite the fact that you had 3 daughters.
Well, but this point,
well, this was long before I got married.
yeah.
And so then I had the opportunity of spending 1 semester in medical school in a hospital in downtown London that Johns Hopkins was affiliated with and had programs with. And one of the pediatricians there was one of the world famous pediatricians, had published a 2-volume textbook on pediatrics. And so even though I was on an adult ward, I caught him in the hall one day and said, "Hey, can I come go around with you?" Well, of course, the answer is always yes. And so I went with him. And for 4 hours, you know, I was with him and his residents and his assigned students and me. And he saw all of his patients every day he came. And they were ages from very young, few months of age, on up to late teenagers. And he got along with every one of them. And I never heard a single child squawk or scream out or complain about his looking at them and examining them and doing that kind of thing. And I thought, he learned how to do it. I can learn how to do it. So I came back to Hopkins and signed up to become a pediatric resident. And that's how I got into it.
You know, that's really an amazing story, but it's also, I think, a universal truth. That if someone else can learn how to do something, you can learn it. It's one of the reasons why we're going to do Hawkins STEM. You saying that, though, you reminded me of a calculus teacher that I had. Because he had a sign outside of his office. If this idiot can learn it, you can. So now, there's so many questions I want to ask you. I want to ask you about, you know, like the transition from undergraduate to medical school. When you were a farm boy, because you grew up on a farm.
No, just grew up with a lot of trees in his backyard.
Oh, you grew up on a lot of trees in your backyard.
Yeah,
it
was in the city.
Oh, okay. And you grew up in California.
Yes.
And so how did you wind up coming from California to the East Coast?
Well, I decided somewhere in high school I wanted to be a physician. Mm-hmm. And so I went to college in California, and took a pre-med course. And nobody does that anymore, but I was a pre-med major. And then I came to, getting to that time where I had to decide on medical school. So I went to a physician that I knew had taken care of me for a long time, and I liked him. And I said, what medical schools should I apply to? And he gave me 5 names. And he had a reason for them, but I don't remember exactly what his reason was. But nonetheless, I applied to those 5 just because that's what he said I should do. And the first one to accept me was Johns Hopkins. I thought, well, that's a famous place. That's a good name. I'll take it. So I didn't wait for the other 4. I just said yes to Johns Hopkins. And then I graduated from college and went back east to medical school.
There's the reason that he paid, tell how you paid for Pomona before you went, how you got to go to school.
Oh, I went to Pomona College on a paperboy scholarship.
Wow.
The man who I worked for in the small town that I grew up in had convinced Norman Chandler, the owner of the Los Angeles Times, that he should begin to give carrier boy scholarships. So the year before I graduated from high school, he started giving carrier boy scholarships. So I applied for a carrier boy scholarship and won one of his 5. The Los Angeles Times is a huge paper. There are a lot of carrier boys. And there were 5 of us that won them that year. One of the guys went to UCLA. He got $13 a semester. I went to Pomona College. I got $780 because it was a private school. So your tuition was $780 a year.
A
semester.
Yeah.
Wow.
Yeah.
Especially against what people are paying.
So
now.
my father didn't have to pay for my tuition to college, and so he paid for my tuition to Johns Hopkins.
Okay.
And that's how I got to Johns Hopkins. And then when I was doing my residency at Johns Hopkins in pediatrics, I went in to talk to the chairman of the Department of Pediatrics about my career future. And all he did was want to talk about his own interests. And somehow that made me livid. I don't get livid about many things, but it made me livid. And I went home, I grabbed the phone and called Boston Children's Hospital and said, do you have an opening for the 3rd-year resident? Nobody ever does. They did. And I said, I'd grab it. So that's how I went to Boston Children's for my 3rd year of residency, which was the best thing that ever happened to me in my life. Because that's where I met my wife.
That's the story. That's the story.
Yeah, and who was I had a magnificent marriage to a really incredible woman.
Who was also in STEM.
Who was a nurse.
Well, she was a nurse.
Yes.
And so we met over a bedside, and then I since learned that she was very bright. She didn't continue nursing after we started having babies. She had done a lot of interesting things as a nurse, but she didn't do much more the rest of her life, except children who were on shots for their allergies and so on didn't have to go back to their doctor's offices to get them. Anybody in our community, they just came to our kitchen and she gave them. But that's about the last thing that she did.
She was a community organizer. She started
she was an organizer.
And garden co-ops and that
kind
of thing. And she worked for the Virginia Department for the Boys for a while. She was a nurse for another few years, but she really didn't practice very much.
Now, I want to go back to something. Again, you're a pediatrician. And you were seeing patients. You were in private practice, yes?
Never in private practice. I was always on a university faculty.
Okay. The reason why I bring this up is because going through my parents' old papers, of all things, what do I find? I find a vaccination card signed by my pediatrician, Dr. Joseph Rose. And I think I'm going to do a separate video on him because he was a very popular pediatrician in Washington, D.C. But I opened a little card, and because it had his name and his, the fact that he was a medical doctor and the date of birth. But each line told which vaccination you were given and the date. We were talking about vaccinations while we were having lunch just now. What do you think about vaccinations for children?
I have always said that the most important thing that a pediatrician does for his patients is to immunize them.
Mm-hmm.
Immunizations have absolutely transformed our life in this country. The leading cause of death in the community in which we're living now was diphtheria.
Mm-hmm.
And we have analyzed the number of children in our graveyard who are 18 and under and plotted it out as a graph. And deaths in this community among children stopped like that in 1920, the year that immunization against diphtheria was initiated. Since that time, there have been several childhood deaths of children who were only a few weeks old, who were born with congenital malformations that were lethal, and a couple of suicides. Other than that, no deaths. Just stopped. And before that, children were dying right and left. It's perfectly astonishing. And of course, then, just 4 years after that, 1924, 100 years ago now, we got tetanus immunization. And tetanus kills half of all the people that come down with tetanus. And to this day, there's not a single thing known to treat tetanus. When you get tetanus, then it's just a coin flip. Half of the people that get tetanus are going to die, and half of them are going to live. I was in practice. We immunize almost everybody against tetanus in this country, and we redo it. If you go into a hospital today and they say, "Is your tetanus up to date?" and if you say no or "I don't know," they just simply say, "Roll up your sleeve. Here we come." I just had that happen. I knew I was over the 10 years when I just got a cut 9 months ago, and I said, I need a tetanus shot. And when he came, I said, let's just celebrate. It's now 2024, and this is the 100th anniversary of the beginning of tetanus shots. You and I celebrate by giving me a shot of tetanus. He was a nice guy, a nurse in a small hospital in Maine, where I'd been injured. But anyway, and then we got whooping cough. And then it wasn't until after the Second World War that we had our first immunizations. We had smallpox immunizations back in the late 19th century, when someone noted that people who had been infected with cowpox never got smallpox. And so they started giving everybody in the countryside cowpox, which by an immunization, stick it in your thing. And so we'd been doing that for that viral illness. But we had no other viral illness that we protected until a man named John Enders became fascinated by science while he was a history major at getting his PhD in history at Harvard, and he quit and joined the microbiology department. And when he graduated, he was such a smart guy, they hired him, and he then, somewhere in the late 40s or 1950, began trying to grow viruses in culture. And by the late 50s, he had learned how to grow viruses in culture. So first we had polio vaccine developed on with his techniques, and then we had measles, mumps, German measles, and chickenpox vaccines, all following in the early 1960s, reducing, well, measles is the most dangerous of those for the average population, and we actually got to a point where we had almost no measles in this country. It was considered eradicated because of the measles vaccine that was developed by Dr. John Enders. And then we had this false notion put into being that measles immunization causes autism. There was one study that was a fraudulent study. They found that it was fraudulent. They took away his license to practice medicine. But that concept of measles causing autism was still put out into the countryside. Large study in this country showed that it was absolutely no link whatsoever between measles and autism. But there are still many people now in the anti-vaccination group, and we have amazingly enough people even at the government level now talking about anti-vaccination. And so we once again have measles, and of course measles, the disease measles can kill you, and if it doesn't kill you, it can hurt you very badly. I have sent to custodial care a patient that I had that had measles when he was 5 years old, and after a week in the hospital we realized he had no more brain. It will do that to you. It'll also kill you. Yeah. It's an awful disease, and there are people who are not immunizing their children against measles anymore, even though it's quite safe. There's very little real danger to the immunization. So it's the fraudulent attack on immunization in the United States is very disturbing. There are some of them that can cause very occasional side effects. Polio, we had trouble with the type 3 polio when it first came out, and then they had to fix the way they made it. And the whooping cough vaccine, there was one case of 1,000 would have some trouble with that. So in the 1960s, they fixed that. Mm-hmm. And there's no problem with it now, and so it's. And the other thing is that people are, we're living longer now, and a lot of that is because nobody's dying of those diseases that we immunize against, and there's very, very few people that are being injured by immunizations now, and the concept that measles immunization causes autism and so on has been completely debunked. So yeah, I just think that the immunization is one of the great magics of our time. Of course, the man that learned how to grow viruses, John Enders, grow viruses in culture, he, very shortly after he published, went to Sweden to get a Nobel Prize.
Okay.
And one of our Dad's claims to fame is Dad's very best friend and roommate, and my kind of godfather, if I had one, was his last fellow. So Dad's good friend John Neff was John Enders' last fellow. So there's a direct connection to him.
So now, sir, let's go back from that. Let's go back to when you were an undergraduate, and let's go back to when you were a pre-med student. What was the toughest course that you ever had to take?
Well, I never thought most of the science courses were tough, because I'm just like so many people doing that, going through taking all the biology and the chemistry and so on. You're so darn fascinated by what you're studying that it didn't seem to be hard to me. Now you hear people talk about chemistry is hard, or there are certain biology classes that some people find are hard. But for many of us, particularly, all the pre-meds were taking the same things. None of us found these courses particularly hard because they were so exciting and interesting.
So now, how did you organize yourself to study?
Oh, I don't know.
Okay.
I didn't do anything unique. I was in a college where I lived on the campus, and so my life was entirely on the campus. And during the week you went to classes, you played your sport, and you studied.
Now, what sports did you play?
Oh, I was a swimmer.
Oh, okay. All right.
Well, in California that means I swam competitively, and I played water polo.
Okay. All right. And of course, you were close to the beach anyway, so.
Well, yeah, but you don't play water polo in the beach. You go down and ride breakers. And that was I was in college before surfboards.
Oh, okay. All right.
Well, didn't you have sorry.
No, go ahead.
No, Dad had
The guy that lived next door to me in my college dormitory founded the company called Hang 10 that made surfboards. He retired a millionaire when he was 45 years old.
It works out that way. Well, sir, I want to thank you very much for spending time with us. And there's a whole bunch of other things I'm hoping we can talk about on camera. I really wish, though, we had recorded some of the conversations we had before we started shooting this.
Okay.
Because, folks, if you're watching this, if this is the kind of content you want to see, please like and subscribe and share this with your friends. But know you're getting a benefit hearing from Dr. Lorne Garrettson.
Thank you.
All right, thank you very much, sir.